these are called immunodeficiencies. Okay, are you there? Yeah. What is the name of this condition? I just made a mistake. I should not have tell you that what is our topic. I should just have told you that attempt this question. Okay, just see this. Now we have done already. That's why. Uh, the, okay, okay. Come on, just attempt this option question. Go on. Hmm. Yes. Fir- First of all, in again in any question, we just have to focus on the age of the patient and yeah, and sometimes gender of the patient, because there are some genetic diseases which are especially prone to boys, or which are especially prone to girls. For example, X-linked diseases are very in X-linked diseases boys are very susceptible, because the X chromosome from the comes only from mother in case of boys, because the boys have the genome of XY, and the girls are blessed in this case because the girls have two X from father and from mother. That's why there is 50% chance of X-linked syndromes in case of girls. However, any X-linked dominant syndrome, any X-linked dominant genetic condition is always going to be susceptible. It is always going to be occurring for the boys. Okay, that's why we have to sometimes focus on the gender, that what kind of gender we are focusing on the patient. Okay, so and the age 13 month, that means my child patient is in the pediatric age. That means he is only 1 year. Okay, so that means he is suffering from any kind of genetic condition. So my option is gonna be genetic condition, and I can see here that all these are genetic conditions. Okay, all options are genetic condition, chronic granulomatous disease. And I want to tell you one thing more. There is a broad picture. Okay, you have to keep in your mind, whenever any enzyme is deficient or any disease is occurring in which any enzyme is deficient, that means a protein is deficient. Okay, if a protein is deficient, what that means is there is any kind of gene abnormality, because proteins are always expressed from the genes. So all the genetic abnormalities must have any kind of protein deformity or any kind of enzymatic deformity, because enzymes are proteinaceous in nature. Okay, almost all enzymes, 99% enzymes are protein in nature and get expressed from any specific gene. All the genetic diseases are always going to lead you towards any protein abnormality. That's why any enzymatic abnormality. Okay, and in all these conditions, there is a kind of enzyme or protein deficiency. In agammaglobulinemia, this is also in agammaglobulinemia, there is no antibodies. In CGD, chronic granulomatous disease, option B, there is deficiency of NADPH oxidase. Again, it's an enzyme. In case of cystic fibrosis, there is a CFTR gene problem. Okay, what is CFTR? CFTR. This is a kind of channel. You don't have to focus on that because it is a topic from respiratory section of the first aid. So you just have to keep this thing in mind. This is cystic fibrosis is also a genetic condition, and that is because of CFTR gene abnormality. Okay, then is the primary ciliary dyskinesia. This is also genetic abnormality. In this disease also there is a Danon protein deficiency. Okay, Danon is a protein which is responsible for your cilia in your body or flagella in your body, because in your body the ovum ova or the sperms in case of male, all these require the ova inside of the ovary and the sperms. Okay, the ova and the sperms, the gametes. Are you getting my point? These these move these move with the help of flagella. Okay, ova ova from the ovary and sperm from the testes towards the penile organ, then again in the vagina. They all move and towards the uterus with the help of flagella. Okay, flagella is a kind of whipping motion. Flagella gives the motion to the ova and sperm. So this is all possible because of the dynein protein. Dynein protein is a protein which is helpful for the formation of the flagella in case of the ova and sperm. Okay, and cilia in your respiratory system are moving. Okay, they are working as an escalator for the mucus and for the to remove the pathogens. Once the primary ciliary dyskinesia happens in your body, there will be problem in motion of these cilia. Okay, there will be problem in motion of ovum and ova and sperms. Okay, that means I just want to tell you here what my purpose is, that this is also a genetic problem which is due to a protein deficiency. Okay, you have to keep that thing in mind only. Then comes our today's topic, that is severe combined immunodeficiency. This name is also showing that the immune deficiency is going to be very severe, that all the organs of the body are going to be infected. As in this case, 13-month-old baby is brought to the emergency department due to cough and increased work of breathing, means there is problem with the respiratory system. Okay, then comes on physical examination, he is tachypneic, that means he is respirating very rapidly. Okay, he is breathing very rapidly and has perioral cyanosis, that means there is bluish color around his lips. Okay, or around his mouth. A chest radiograph shows bilateral interstitial opacity, means again there is something happening inside your respiratory system. A review of his medical records show recurrent history of otitis media, that means your ear is infected. Pneumonia, that means again your respiratory system is infected. And thrush, that means your mouth is infected with candida. Okay, what is thrush? Thrush is a mouth infected with candida. Okay, so okay, I am here. The thrush is occurring, that means your mouth is also infected with a candida. Okay, candida infection. Yeah, candida as well as chronic diarrhea. That means again his gastrointestinal system is also infected. His respiratory system, his ear, his mouth, and his gastrointestinal system, all these things are infected. And again the patient undergoes bronchoscopy, and the bronchoalveolar lavage shows Pneumocystis jirovecii. Do you know anything about Pneumocystis jirovecii? Pneumocystis jirovecii is an opportunistic infection that happens whenever your body gets immunosuppressed or whenever your body gets depressed immune system. Okay, it is an opportunistic infection, that means it infects your body when your body is immunosuppressed. So the clinical picture is showing that this 13-year-old baby is suffering from a disease or a condition in which your immune system is not working. Okay, and this disease is called severe combined immunodeficiency, because normally we are facing like 75% of bacteria that are not harmful to our body, just because of our immune system. Okay, just because of our immune system is protecting against different kind of pathogens. Okay, because there are so many bacteria present in your environment. In any environment there are lots of bacteria, there is abundance of bacteria, but you are still healthy just because of this immune system. Now when your immune system gets depressed, your baby cannot face the environment. That's why you have to keep your baby in a bubble, in a single room. That's why this disease is also called as bubble baby syndrome. Okay, that means you have to keep your baby very protected, because he cannot face the environment, he cannot face the pathogens of the environment. Okay, he is very threat prone. Now we did this that this is severe combined immunodeficiency syndrome. What is happening in your severe combined immunodeficiency syndrome? In SCID, because this is a genetic condition, there is a deficiency of a gene or maldevelopment of a gene, and because of that gene, the enzyme is one of the enzyme is going to be deficient, and that enzyme is ADA. That enzyme is ADA. Okay, adenine deaminase enzyme. Okay, adenine deaminase or adenosine deaminase. This is same thing. This enzyme is deficient, and this enzyme is deficient in a manner that is autosomal recessive. Okay, that is autosomal recessive, because in your body you have got 46 chromosomes. Okay, but two chromosomes are X and Y. Two chromosomes are X and Y, and the X and Y chromosomes are genetic. Any disease which is occurring because of X and Y chromosome is called as X-linked or Y-linked. Okay, but all the other 22 chromosomes, any gene that is defective in all other chromosomes is going to be called as autosomal. Okay, the gene related to X is called as X-linked genetic, and gene related to all other 22 chromosomes which are for suppose here present, here, these are 22 chromosomes. For suppose any gene defective in these chromosomes is called as autosomal. And when two, for suppose in genetics, okay, let me just write this. In genetics, we get one dominant gene and one small gene. Okay, one recessive gene. For suppose this is A dominant and B dominant. Okay, for suppose this is from your father and this is from your mother. Okay, both these parents meet each other, then there are four sets that could be formed from this combination. Okay, and these four sets are A capital, B capital. These four sets could be A capital, B capital. Okay, or it could be A capital, B small. Okay, one of the genes, one of the allele is coming from your father, one of the allele has to come from your mother. Okay, so this could be A capital, B capital, this could be A capital, B small, then this could be B capital, A capital. That means again B capital, A capital means AB. This is again the same thing. Or this could be, okay, sorry, this could be A capital, B capital, A capital, B small. Okay, then it could be A small, B capital, A small, B capital, and then it could be A small, B small. Okay, A small, B small. This last one, the 25%, is getting both the recessive or both the non-dominant genes or both the defective genes from the mother and father. That's why this pattern of inheritance is called as autosomal recessive. Okay, that means homozygous condition, because in heterozygous condition still you have got one gene proper functioning. That's why you will have some enzymes that will function properly, but in this patient there will be zero enzymes, because there are no proper genes, no proper functioning genes. That's why this is called as autosomal recessive pattern of genetic inheritance. Okay, you got my point now? And same goes for X-linked. For suppose a baby has got a mother X and X small, and father with X small and Y capital. Okay, now if we will make arrangements like this same again, then we will get a pair in this case, which will be like, okay, let me tell you, let me make this pair. Can you help me making this pair? Tell me, how will the pairs will be formed? Yes, X capital and X small. Okay, then again X capital and Y capital, and then again will be this X 2 small x, okay, 2 small x, and then will be small x and a big Y. Now tell me, from these four babies, which baby will be defective, or which baby will gain the, okay, and another one, these both babies will be defective. Okay, so let me tell you, these both babies will be defective. Why? Because both these babies are gaining a small gene from small x gene from their mother and father. This yeah, 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 because in this case there is one capital X which can perform normally. In this case there is one capital X which can perform normally, but though both these babies have got the X genes which are defective, and this boy is very unlucky because he has got one gene from his father, and that lone gene is also defective. Okay, so sorry, he has got this X gene from his mother, but this gene in the mother is defective, this lone gene is defective. That's why this boy baby will be defective also. But the X-linked recessive pattern is shown in this case, okay, because this third baby has got both the genes recessive, and that's happened in case of your many X-linked diseases. Okay, yeah, it affects female because this is female. Okay, this is not a specific case, I have just shown you, but this in this case we just have to understand that how X-linked and autosomal recessive things work. Okay, I just wanted to clear that out. So I think we are clear with that. Now we have to move towards the topic, that is severe combined immunodeficiency. Okay, so this is question 25 again, and this is the ID name. Okay, this is the question 37. We have also question number 25. We can attempt that too. That's why I have written here. Now I will also write question number 38 and ID number, just to remember the thing, 2078, because in UWorld you have to keep the ID in your mind. All the questions have different IDs. Okay, question number 38, 39. Now we have to move on towards our topic. hmm. This FA, this first aid edition, is 2023. Yeah, questions are 2021. Yeah, these are from the 2021. Almost these questions are resembling to the 2023 edition, because some new questions are going to be added. I will buy in some days the new version of UWorld, then we will do it from there. Okay, okay, yeah, I have to wear, I have, yeah, 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 it's similar in all these UWorld questions, because you have to just practice for the question attempting. Okay, you have to just set your brain with the reflexes of attempting question. Okay, so now we have got severe combined immunodeficiency. Several types, including defective IL-2 or gamma chain, most common, that is X-linked recessive. Okay, then another one is adenosine deaminase deficiency, that is autosomal recessive. So in case of SCID, there are two patterns, okay, of the disease. If disease is occurring in a baby, there could be two possibilities. One is X-linked recessive, we already discussed, and other one is autosomal recessive. Okay, the autosomal recessive one, the enzyme deficient is adenosine deaminase. Okay, in case of autosomal recessive, what is deficient? Deaminase, or autosomal recessive ADA deficiency. Okay, I am just writing for simplicity. Okay, just keep this thing in mind. And then other one is X-linked recessive. Another one is X-linked recessive. This X-linked recessive is defective because of a gamma gene, because of a gamma chain, defective interleukin 2 defective IL2R gamma chain. Okay, this is not that much important for today. Today, what topic is important is this adenosine one. Okay, so just you have to keep this thing in mind that most common one is X-linked recessive. In this X-linked recessive, which gene is deficient? IL2R gamma chain. Okay, can you tell me which gene is defective in X-linked recessive pattern? Hmm. And in case of autosomal recessive, what is deficient? No, in autosomal recessive, adenosine deaminase. Okay, this was AR for autosomal recessive and ADA deficiency. Okay. Okay, see, let me tell you once again. There are three patterns. Okay, one is autosomal, one is X-linked recessive, and other one is autosomal recessive. Then comes the RAG mutation. So first we have to do this X-linked recessive, that is due to defective defective IL2R gamma chain. Okay, that is most common one. Then other one is autosomal recessive, that happens because of deficiency of adenosine deaminase. Okay, yeah. Then comes the RAG mutation, that occurs due to VDJ recombination defect. Leave this right now. I will tell you later what is this. Just keep in your mind that RAG mutation occurs due to VDJ recombination defect. Okay, or I can tell you here that, should I tell you that VDJ? Do you remember we already studied about VDJ complex, that is responsible for formation of different kind of antibodies inside your B cell. Should I go on to that or tell you later? Okay, okay, I will tell you. Just keep this thing in mind that VDJ complex is helpful for antibody formation. For antibody formation. Okay, just keep this thing in your mind. We will get back to this thing, that what is the concept of VDJ. Right now we have to focus on X-linked recessive and autosomal recessive. X-linked recessive and autosomal recessive. Autosomal recessive is because of ADA deficiency. X-linked recessive is because of IL2R gamma chain deficiency. Okay, I am going to write this for you, that X-linked, X-recessive, X-linked. Okay, I am just writing it X-linked. X-linked is because of IL2R gamma chain deficiency. Okay, am I clear to you? Just remember this thing, just keep this thing in mind. This is the basic point, this is the backbone of this whole topic. Okay, if you keep this thing, you have to keep this thing in mind till the end. Now come towards the presentation, that how will your patient present to you. This patient will present to you with failure to thrive, chronic diarrhea, thrush, recurrent viral, bacterial, fungal, and protozoal infection. Let me tell you one thing, that we are in a topic that is named immunodeficiencies. Okay, there are so many immunodeficiencies. We will study them later. That then in these immunodeficiencies, some are purely B cell deficiencies, like we have got here. These are purely B cell deficiencies. Then there are purely T cell deficiencies. Okay, then are the B and T cell both disorders. Okay, severe combined immunodeficiency is one of them. In this severe SCID, there will be no B cell, there will be no T cell. That's why since your T cell is responsible to kill the viral and fungal infections, and your B cells are responsible for antibody production to kill the protozoal and bacterial ones, or for the complement system. So since the B and T cell both are absent, or both are not working properly, that's why you will get severe recurrent infections again and again. Okay, there will be failure to thrive. What do you mean by failure to thrive? That there will be, your baby will be very weak, because he has got chronic diarrhea. Whatever he will eat, or whatever he will intake, all will be excreted out, all will be digested out towards the outside in the form of diarrhea. Okay, now come, what will be the findings of this case? Okay, what will be the findings, that how can you see that this patient is suffering from SCID? There will be less T cell receptor excision circles. I don't want to go deep into this. Just keep this thing in mind, because you will get confused if I am going to explain this right now. But just keep this thing in mind, that on the scenario you will get decreased T cell receptor excision circles. Okay, there will be decreased T cell receptor excision circles. Again, because just keep simple thing in mind you can keep is that T cells are decreasing again very much. T cells are defective right now. That's why everything related to T cells will be low in your body. And part of newborn screening for SCID in US, you have to perform newborn screening on every patient, because you have to diagnose them for SCID by seeing the chest X-ray. By seeing the chest X-ray, there will be absence of thymic shadow. Okay, because T cells are going to be formed inside the thymus, or going to be educated inside the thymus. Now, since the T cells are not functioning properly, so that there will be no thymus present and no germinal centers, which we already discussed in case of lymph node. The germinal centers are responsible for the growth or for the maturation of the active B cells. Okay, so now thymic shadow is absent because T cells are not present, thymus is not present. Germinal center is absent because B cells are not present. And again, T cells flow cytometry. We will check the T cells on flow cytometry. There will be deficient T cells or there will be abnormal T cells. Okay, so we have almost covered the scenario which we discussed on previous case. Okay, we will see the explanation. Then we have to go back towards the biochemistry, because why this disease is occurring and how this disease is occurring, how the metabolism of this disease is going to place. That is in a topic which is related to biochemistry. Okay, can you see, we have got this picture. This is the purine salvage pathway. How I will integrate this biochemistry to our immunology module, that how this biochemistry topic is related to our today's topic. Okay, that this is adenosine deaminase deficiency, and this is one of the major causes of the autosomal recessive SCID. Okay, SCID. Okay, we will get back to this, but first we have to read the explanation. Okay, go on and read the explanation. Okay, see, again, severe combined immunodeficiency. Okay, etiology, that means cause of this is genetic defect leading to failure of T cell development. I already discussed that. And then B cell dysfunction due to absent T cells, because normally what T cells do, T cells show an antigen or present an antigen to the B cells so that B cells can mature. Since now these T cells are not present, B cells will not also get matured. Okay, inheritance, there are two patterns, X-linked recessive and autosomal recessive. We already discussed this. The most common one is X-linked recessive. Okay, recessive. The most common one is X-linked recessive. I am going to write, keep the most common things in your mind, because this is going to appear on your test day, that what is most common, what is not. Okay, X-linked recessive is MC. MC means most common. Okay, the clinical features are recurrent, because the T and B cells, which are major immune cells, are not present. That's why we will get recurrent, severe viral, fungal and opportunistic infections, pneumocystis infections. Okay, and failure to thrive, that means baby will be weak because of the chronic diarrhea. Okay, because normally babies are very excited in their young age. Okay, they make so many mischievous things, they are very naughty, but these babies will just be somnolent. They will just need to sleep and cry. They will just try to sleep all 24 hours, because they have not got energy in their body for the movement, because their nutrition is not proper, just because of the chronic diarrhea. Okay, what is the treatment? Because the T and B cells are abnormal but are maldeveloped, so the only resolution or the only solution is stem cell transplant from a donor. That is the treatment. Okay, so we just almost again covered this topic. Now we have to read this. I want you to read this. Go on. Savior combined. Hmm. Again, once again, same thing. Defective T cell and B cell dysfunction, because T cell cannot present this antigen towards the B cell, so that B cell will be defective. B cell will not get chance to mature. Okay, go on. Okay, so there are two patterns. One is mutation in different genes. For example, the mutation was in a RAG gene. Okay, the mutation was in RAG gene. The mutation, just cram this thing. The mutation was in a RAG gene, and another pattern is the inherited in the case of X-linked or autosomal recessive pattern. This is also related to genetic abnormality, but this is not mutation. There is difference between the mutation or in absence of the gene. Okay, you are getting my point. Go on. Okay. Okay, let me tell you one thing more, because I don't have I did not tell you, because this is going to be our next topic. There are two kinds of immunities. One is humoral immunity. Okay, one is humoral immunity. Humoral means fluid. Humoral means fluid. This happens in form of antibodies. Okay, by B cells. And the other one is cell mediated. That means cells are it, cells are themselves involved in this, and that is caused by T cells. Okay, because T cells T cells themselves secrete cytokines, interleukins, IL, and interferons. Oh, sorry, tumor necrosis factor, TNF. Okay, am I clear to you? There are two kinds of immunities. Humoral immunity. Word humoral means fluid. Word humoral means fluid. That means there will be antibodies which are performing the functions, and by the B cells or especially plasma cells. Okay, whenever your teacher is asking you in any question or viva that who performs the humoral immunity, you don't have to tell the B cells. You have to tell plasma cells, because plasma cells are actually mature B cells themselves that secrete the antibodies. Then comes the cell mediated immunity, that is performed by T cells, because cells themselves are involved in this. Cells themselves are responsible to kill the pathogens in this, and this immunity is also called as cell mediated immunity, is also called as delayed type. Okay, delayed type hypersensitivity or delayed type, but just remember delayed type. Okay, so move on. The absence of T cells causes severe defects in the cellular immunity. Okay, go on now. We already discussed it. Go on from here. Okay, just give me a minute. Okay. Yeah, Jerovica. Okay. Hmm. Am I clear to you? I already told you that B cells are responsible for this humoral or antibody mediated immunity. Okay, go on. Go on. Okay, remember one thing I already told you in previous sessions, that there is a there is an antibody named IgA. IgA 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 is always going to be responsible for the mucus related pathogens. So, do you have mucus in your respiratory tract? Everyone. So, understood point is that these pathogens would be present in your upper upper respiratory tract URT and gastrointestinal tract. Okay. So, whenever IgA is deficient, mucus related pathogens will be active and upper respiratory tract and GI infections will be very normal. And the same is happening here. Recurrent sinopulmonary. What is sinopulmonary? Sinus and pulmonary. That means upper respiratory tract and lower respiratory tract. So the whole respiratory tract is infected with the bacterial infections, pneumonia and otitis media. Ear infection is one of the upper respiratory tract infection. You can include that in that. Okay. Otitis media is ear infection. Okay, go on. Typical means very common. Okay, so again I already told you, because these things are upcoming, I am telling you in advance. Okay, so I already told you GI tract will be infected. That means chronic diarrhea. Okay, because the GI tract is infected, normal food materials will not get absorbed into the blood. That's why your patient will get malnutrited and he will failure to thrive. Okay, then go on. SCID. What do you mean by lymphopenia? Hmm. No, whenever we use word penia, that means absence. Okay, absence or less. Okay, not the excess. For excess, we use a word cytosis, lymphocytosis. That means lymphocytes are very excess, are in very much excess. Now, lymphopenia means absence of lympho lymphocytes. And what are lymphocytes? B cell and T cell. B cell and T cells. Okay, and what is the other thing? Hypogammaglobulinemia. Okay, hypo, what can you now tell me what does mean, what does hypogammaglobulinemia means? Absence. Okay, yeah, absence, not absence but less amount. You can say less amount, because it is saying hypo, not the a. Absence, when we would use the absence word when it is saying a gamma globulinemia. Can you just remember, we just got an option here, a gamma globulinemia. This a gamma globulinemia means zero or absent gamma globulins. What are gamma globulin? Gamma globulin are functional unit of antibodies. Okay, so what I am going to write here, less amount of antibodies, less amount of gamma globulin, or less amount of GGs, okay, gamma globulins, or antibodies, because antibody is a fancy name for gamma globulin. See, gamma, I am hesitating, my tongue is hesitating saying by saying gamma globulin, hypogammaglobulinemia, but it is very fancy to say there are less antibodies. Antibody, that means it is a fancy word. Okay, so absence or less in lymphocytes means lymphopenia. Whenever the word penia is coming, you have to keep in your mind that it is going to be absence or less amount, not the excess. For excess, we use a word terminology cytosis. So, what are the laboratory findings? Lymphopenia and hypogammaglobulinemia. You have to keep this thing in your mind, because this is very important point for any scenario or any case. Okay, go on. Hmm. Hmm. Why congenital HIV infection can present? Because again it is and immunocompromised. It because normally in T cells in your body, T helper cells, Th4 cells are very much responsible to keep you protected from HIV. Now T cells are not being formed properly, and I am going to tell you one thing more. T cells are not being formed properly because of ADA deficiency. Okay, adenine diamine deficiency, and this ADA deficiency will lead you to malformation of DNA. Okay, because this ADA is very much responsible to form the building blocks of the DNA. Okay, how will it be? How will it because the non-formation or malformation of the DNA? I will tell you later in the biochemistry topic. Okay, move on. Read these options. Why these options are incorrect? Go on. Because because A-gamma globulinemia means absence of antibodies. Okay, so antibodies are normally just only produced by B cell. That's why A-gamma globulinemia is an isolated B cell defect. Go on. Okay. Because pneumocystis jirovecii is an opportunistic infection. Who are the opportunistic persons? These persons are very selfish persons. Okay, they see the opportunity and they grab it. Okay, so what is the opportunity present for? When is the opportunity present for? Like, see, when the kidnapper kidnaps a child when the mother or father is not present with him. So the T cells are performing the protector, are performing as a protector or as a defense mechanism in your body. Whenever T cells are not present in your body or T cells are deficient or malfunctioning, pneumocystis jirovecii will see the opportunity to infect the host. Okay. Now in A-gamma globulinemia, T cells are normal, but just only B cells are defective. So the protective mechanism will also be present right now. That's why you cannot see pneumocystis jirovecii. Okay, go on. But right now we just have seen pneumonia in our patient. There were no any kind of SPCs, there was no any kind of osteomyelitis. That's why this option is incorrect right now. I already told you that this is a vast topic. This is a very important topic. We will discuss this in other session. What is chronic granulomatous disease? Okay, go on. Read this cystic fibrosis. Okay, let me read this. So, because this is a new thing. Cystic fibrosis is again an autosomal recessive disease. Okay, that is caused by dysregulation of a chloride channel found in multiple organs, and that chloride channel has got a gene. That gene is named as CFTR. CFTR. Okay, the CFTR is a gene actually. CFTR gene is deficient. That's why chloride channel is not functioning properly. That's why and that is not functioning properly in especially in the lungs and the pancreas. That's why what happen, thick airway secretions and pancreatic insufficiency lead to recurrent respiratory infections and chronic diarrhea respectively. Pneumocystis and thrush would not be expected because these both occur when T cells are not functioning properly. But now in this patient we have got these disorders, so it is not possible for cystic fibrosis to happen in this patient. Okay, we will discuss later what is cystic fibrosis. Just keep in your mind that it is an autosomal recessive disorder. One point to be remembered from this session. Another point to be remembered, it occurs due to dysregulation of chloride channel, and that channel has got a defective gene, that is CFTR gene. and it especially occurs in case of lungs. We will see thick airway secretion in lungs and in pancreatic insufficiency in case of pancreas. Okay, what is the whole mechanism of this topic? We will discuss that later. And again, now we have got, at last we have got primary ciliary dyskinesia. This is again autosomal recessive disease that results in poor mucociliary clearance in the respiratory tract. I already told you that you have got an escalator, an elevator, like elevators in the malls. Okay, there are escalators or elevators in the malls which are continuously moving above and down, so that they can put people down and above, okay, to the floors. So in this case, what this mucociliary escalator do, this keeps pathogens up and down, so that these pathogens could be moved again and again towards the down and up, so that these could be excreted in the form of sputum, or in form of spits, or in form of, or they can go down into the lung, where there are macrophages present downside in the lungs. They can eat these macrophages. Okay, so this escalator is performing this. These cilia are moving up and down just to put the pathogens upwards and downwards, so that these pathogens could not be stagnant. If these pathogens got stagnant or got stuck, they will cause infection to your lungs. So whenever these cilia are deficient, or whenever these cilia, and in these cilia there is a special protein. That protein performs the function of whipping. Okay, have you ever seen a whip? Because it is moving like up and down. So the material used in that whip, or in that cilia, is dynin. When dynin is deficient, this escalator is not working. That's why the organisms or the pathogens will get stuck in the respiratory tract, and that will cause cyanopulmonary infections. Okay, am I clear to you? Then I already told you. Can you see here? Middle ear means respiratory tract and middle ear both are the same things. Okay, why reproductive organ? I already told you that in ova and sperm you have got flagella for motion, because ova from the ovary has to reach the uterus, and sperm from testes has to first reach the penis, and then when it reaches inside the vagina, it has to the sperm has to cross cervix, and from cervix it has to reach uterus to meet ova. Okay, and this whole motion is just possible because of this flagella, and this flagella once again is made up of a protein called dynin protein. Okay, that protein is called dynin protein. I think my spelling is not right now. I think I have misspelled this, but it is, I can pronounce it well, that this is dynin protein. Okay, dynin protein. Just keep this in mind. And I am going to tell you one more very important, this is like 100-buck question. Okay, you have to keep this in mind. Because of this protein deficiency, there occurs a syndrome, and this syndrome is called as Carter-Jenner syndrome. Don't go deep what is Carter-Jenner syndrome. Just keep in mind that due to dynin deficiency, a syndrome occurs, that the syndrome is called as Carter-Jenner syndrome. Okay, are we clear right now? That primary ciliary dyskinesia means primarily ciliary means leading to cilia, and dyskinesia means kinin means motion. Okay, kinetics. Have you ever studied kinetics in physics? Kinetics means motion. Okay, dyskinesia means abnormal motion. Dyskinesia means absence of motion. Okay, so ciliary, that means absence of ciliary motion, because ciliary motion is very important in your body, especially in your respiratory tract. It is just working like escalator of a mall. Okay, where in normal mall, the escalators are keep moving the persons up and down, but in your body these escalators are moving pathogens up and down, so that these pathogens can come out into your sputum. Okay, upwards into your sputum. Via mouth you can excrete them out, or they can go down and down into the alveoli or into the lungs. There are some cells present. That cells are called macrophages once again, and those macrophages in alveoli are called, can you name them? In alveoli, Kupffer cells. These are called as Kupffer cells. This is once again 10 buck question. You have to keep this thing in mind. Macrophages in alveoli are called Kupffer cells. Okay, I am going to tell you one more important point. You have to keep this in mind. Macrophages in skin are called dendritic cells. Okay, and there is another name for the macrophages in the liver. I don't remember. Just let me search this on my phone. I am telling you because this is important point. I have gone through so many BCQs regarding this point. Okay, let me just give me a minute. I have to Google it. Macrophages in these are also called Kupffer cells. Okay, yeah, hepatic macrophages. Okay, you have to keep this thing in mind that I think the macrophages in alveoli are called as the simple macrophage, but macrophages in liver are called as the Kupffer cells. I will tell you later that both of these are called as Kupffer cell. Okay, you have to keep this thing in mind because this is very important point. And macrophages in skin are called as dendritic cell. So now we were here because now what will happen if dynein protein is deficient? Okay, can you tell me, if dynein is deficient, there will be no motion of sperm and ova, and they will not reach uterus and they will not get implanted. That's why your patient will suffer from infertility. Okay, you got my point now, that primary ciliary dyskinesia is. And I want to tell you one thing more important. This is very important thing. In your body, embryologically, when you are a baby, your organs get shuffled from right to left. Okay, all the organs from the right come towards the left, and left side come towards the right. They have to be, they have to move to their origin, or they have to move to their actual area. And that just happens, just motion always happens because of the cilia. Once again, because the cilia, the dynein is deficient in your body from your embryo level. Now when you are in your mother's tummy, when a baby is in mother's tummy, the cilia are not working properly. That's why this motion will not occur, and that's why a condition will happen that is called as dextrocardia. That is called as dextrocardia. Do you know what is dextrocardia? Dextrocardia means heart on left side, heart on right side. Normally heart is on left side, but in this patient heart will be on the right side. Okay, did you get me? Can you tell me why dextrocardia is happening in a patient with primary ciliary dyskinesia? Why heart is going on the right side? Because normally in an embryo, when baby is in mother's tummy, when formation of baby is occurring, the little small organs have to move to their origin, have to move to their different places, and that movement occurs because of these cilia. And when these cilia are deficient in case of primary ciliary dyskinesia disease, so this motion will not occur. Heart will still remain on the right side of the baby. Okay, normally heart has to be first of all on this place, but heart will be on this area, on this side. Okay, heart has to move from the, for suppose this is right side. Okay, sorry, this is right side. Okay, heart has to move from right towards the left with the help of cilia, but cilia are deficient right now because the dynein is not present in your body, in your baby's body. That's why heart will be on this side. All the other organs in your body are similar because you have got two lungs. Okay, because you have got ribs. All these organs, if they are not moving to their side, there will be no any kind of problem. But problem will be for the heart because heart is only one inside your body. Okay, you have got two kidneys, two testes. I have got two testes, two ovaries. All these organs, if these are not moving, there will be no problem for me because if right things on the right are on the left right now, because on both sides things are present, they have not moved, there will be no problem. But problem will be for heart because heart is only one in your body. Heart has to move towards its special position with the help of cilia. Okay, so dextrocardia is an important feature of this primary ciliary dyskinesia. Whenever we will face a question on primary ciliary dyskinesia, we will see dextrocardia there. Okay, now again, affected patients have recurrent sinopulmonary infection in childhood. That is because the pathogens will get stuck in your lungs. They will not escalate upwards or downwards to be excreted. Okay, and decreased fertility in adulthood, because the flagella of the ova and sperm is not working. There will be no motion of these two, and they will not be able to meet at one place. So what is the treatment to this condition? We will do IVF, that is in vitro fertilization. We will take sperm from the testes of the father, and we will put it inside the ova, into the tummy of the mother. Okay, so IVF is the treatment to this condition. You have to keep this thing in mind. This infertility is could be treated. Okay, this infertility could be treated. That's why this is important to remember. If one patient is suffering from primary ciliary dyskinesia, you have to console your patient that all hopes are not gone. Still there are some hopes we can provide you with. We can try so that you can have a baby. Okay, so that's our primary ciliary dyskinesia. Viral or opportunistic infections are not seen in this case, because virus and opportunistic infections happen especially when there is deficiency of T cell. Did we discuss any kind of T cell deficiency here? No, we just discussed the deficiency of dynein protein, and because of that dynein protein, deficiency of flagella, deficiency of motion, deficiency of cilia could occur. That's why bacterial infections could happen, but not the viral or fungal infections which are right now present in our scenario in this case. Okay, so that's why we are cancelling this option. Okay, now the last option, which is F, that is terminal complement deficiency. We already discussed that there is a complement system. In that complement system, we have got the early complements from C1 to C4 and terminal complement C5 to C9, and this C5 to C9 is responsible for the formation of membrane attack complex. Okay, and it results in, sorry, did you say anything? Do you want to ask anything? Okay, let me tell you this. Okay, what we already discussed in complement system, that there is early complement and late complement. Okay, the early complement is C1 to C4 and terminal complement is C5 to C9. C5 to C9 forms a membrane attack complex. That membrane attack complex, that membrane attack complex is gonna do, they will lyse the pathogen, they will lyse the Neisseria. Okay, that's why whenever the terminal complement is not present, you will get increased susceptibility to infection by Neisseria. Okay, but in this scenario which we already discussed, there was no sign of Neisseria meningitis, there was no brain infection. Okay, so that's why we attempted an option which contained severe combined immunodeficiency, because educational objective means this is the whole summary of the topic, okay, which we have discussed. Severe combined immunodeficiency is caused by genetic defect in T cell development, leading to loss of both cellular and humoral immunity. Patient presents in infancy with recurrent bacterial, viral, fungal and opportunistic infection, as well as failure to thrive and chronic diarrhea. Do you want to ask anything from this topic right now, from this question? Have you got any question, or should we move?